The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome. This is Veronica Posada, Physician Relations Manager with Physician Partners. This webinar is presented by Physician Partners and our PRC member, AS Medication Solutions. I just want to let everyone know that you will be muted during the presentation. And we welcome you to enter in any questions at any time, and we'll answer them in the order they arrive. I'd like to get started with providing you a couple questions that will appear on the screen. And the first question, does anyone currently dispense or has dispensed out of the office in the past? You have about 20 seconds or so to answer that. Second question is, how do you feel your center or medical office could benefit from office dispensing? All right, so thank you very much for taking the time to answer those questions. I'd like to now introduce Dan Hawk, Executive VP of Business Development at AS Medication Solutions. Throughout Mr. Hawk's 12 years in medication dispensing, he has established over 5,000 dispensing programs all across the nation. Dan is also an expert on ACO, MCO, urgent care, and employer markets, and is considered the nation's leading expert of dispensing in these specialties. We've had the opportunity to develop a relationship with AS Medication Solutions and the PRC Center. I'd like to hand it over to Dan.
Hi, good afternoon, everyone. I'm glad that you're able to make it today and certainly join me for this lunch webinar. I wanted to launch right into it just so we have as much time as possible for Q&A. Just wanted to give you a little background about who ASM is, formerly known as AllScripts before we broke away from the EMR. We are the originator and still are the largest supplier of on-site dispensing services. We operate our operations out of Chicago, where we have an 85,000 square foot FDA DEA warehouse facility and production facility where we do our distribution. I work out of our California Sales and Service Center, where we have localized customer support, and of course keep West Coast hours to support the clinics on the West Coast. Really, what we're best known for is developing custom dispensing solutions that are really tailored to meet the needs of a specific practice. We do not believe that one dispensing program fits all and is going to fit the needs of every practice. So we really look at an approach to where we can involve anything from third-party adjudication. For those people that aren't familiar with what that means, is the ability to bill Blue Cross Blue Shield, commercial insurance, Medicare, Medicaid, to workers' comp, to really anywhere in between. And of course, we're very excited about our new partnership with Partners of Scripps Mercy Physician Partner. Really, when you look at what we're trying to accomplish through dispensing, is we're looking to strengthen caregivers by providing them a care treatment solution that is designed to improve patient health, lower costs, and enhance revenue streams. A lot of times, I refer to our program as a triple aim initiative enabler. We're looking to increase, patient caregiver experience. We're looking to lower overall costs, and of course, increase outcomes through better compliance through the program. So the way our program works, for those of you who are unfamiliar, is we prepackage medications into unit of use, so there's no counting or filling of the medications on site. We supply you with a software which is going to track all your inventory, keep all your records, essentially keep you in compliance and empower your management team to really control the program. So that's going to be really the heartbeat of your program. And then, of course, supply you with all the tools, knowledge base, that you need, whether it be constructing a formulary, whether getting you a network with insurance contracts. We pretty much handle everything from A to Z through that program, for you. So we do have 24-hour support and 24/7 access to pharmacist support as well. So you always have a phone number you can call. You can get a live pharmacist on the phone if you or any of your providers have questions. Backing up just a little bit from a 10,000 foot view, what is medication dispensing? Medication dispensing is basically having medications on site to be able to provide to your patient at the point of care. Why this has grown so much in popularity is that 90% of every treatment plan that is being prescribed out of your office is going to include prescription medications. So this medication dispensing for many practices, or most practices, is going to be their most outsourced ancillary activity. So as practices are looking to insource what they're outsourcing most, to provide either more holistic patient care or to provide additional revenue opportunities, this is a great place to look at because it's low upfront cost. You're not putting in a machinery that's going to cost you 6 figures. You're looking at a program that's going to cost you $5,000 to implement and should have some 2-month ROI potential. We have there's a lot of different programs available out there. So as we go through, and we only have a short period of time today, but I'll make sure to share my contact information, and we can help you with any other questions that you have. But we have things that range from personal insurance or from personal injury to workers' comp to commercial insurance to cash and carry to Medicare Advantage program or capitated care. So really my goal is just to kind of provide everyone with a base understanding of what's available. And then, of course, we can kind of drill down and talk, how those may affect the people in this call the most. Here's where we traditionally touch the marketplace today. So I kind of threw everything into 3 different buckets, not knowing who exactly was going to be on the call. So in one bucket, we have prescription cost containment. This essentially is capitated care. It's employer worksite clinics. It's student health, community health, federally run programs, where basically they're looking to drive cost out of the system. So by taking a process which is very expensive, which is a pharmacist or a pharmacy tech counting out 1 pill at a time, we take that, run on high-speed automation machinery, drive the cost of pharmaceuticals down by buying direct from the manufacturers and going straight to the packaging line. We have what's called the patient pay or commercial pay market. This is a patient using either no benefits or their insurance benefits to use through our program. And so that's any type of, that can be any type of center throughout an IDN, from an oncology clinic to a family practice. This model is really popular for primary care, urgent care, any type of surgical practice where there's a benefit of, making sure that the extra convenience of getting that patient, having that patient leave with their medications on site. And then, of course, multi-specialty. We also separate out workers' compensation. As for those that you participate in workers' compensation, it's a little bit different than the commercial paying market, and we can certainly walk you through that. But that's going to be your occupational health, orthopedic, physical rehab, and pain management type of clinics. Here's an example of what a dispensing setup looks like. Very simple. We have a barcode scanner, a computer, and a printer. All you have to do is have access to the internet, and you'll be able to access our program to the system. So it's literally select the patient from the, in many cases, send it from the EMR, select it from the drop-down list, scan the medication, print out the pharmacy form. So very, very easy process that takes about 30 seconds to dispense up to 2 to 3 minutes. So again, we're able to, we are AllScripts certified. That means if you have the ability to e-prescribe, you have the ability to scripts directly into our system. What that means for you is, better operationalized stream flow, of course, better record keeping, and an easier program for your staff to operate. So we try to make it as simple as possible, especially through using the barcode scanning technology to ensure that the medication, has been put into the patient's hands. For those of you that aren't very versed in physician dispensing, it has been a very largely increasing trend. So this market seems to be growing at about anywhere between 50 and 100% year over year. So a lot of people are very interested in why the surge in dispensing. A lot of it's patient preferred. So as providers are going out there in essentially, or as patients are becoming consumers, providers are learning to adapt by creating programs that the consumer wants. And so being able to offer a full source of solutions, make it a one-stop shop per se, has really helped driven the popularity of our program. It's also peer tested. Probably everyone on this phone knows someone that's dispensing. We have over 100,000 providers across the nation dispensing medications. So as far as an in-office ancillary, this is one of the most peer tested programs that you're going to find in the nation. One of the things that I've found just very exciting is the increased patient satisfaction. We have many customers that are national customers that have sent out patient satisfaction surveys, and our program is listed ahead of things such as wait time and in urgent care. In other areas, with our Medicare Advantage programs, the CAHPS scores were increasingly higher due to the decreased the increased convenience and access and the decreased cost through the payment. So it's a very, very easy program to use, and really that's what we attribute to the rise of the popularity of physician dispensing out in the market. A lot of people will say, what do I need to look at? If I want to start with a great dispensing program, what do I really need to seriously consider? I'll tell you, if you make it, you need to make it a part of your service identity, meaning that this becomes a part of your practice. So if you have a family practice and you deal with a lot of disease management, you're dealing with the big three, work to dispense in 90 and 180 day supplies and create that care continuum. If it's part of your urgent care, help help market the fact that it's a one-stop shop for those type of things. Understand your patient demographics. So if you're high in Medicaid or something like that, you need to be, really adjudicating claims. If you're high in cash pay, there's really no need. Also make sure that people have a very tight formulary. Formulary is what we consider the medications that you'll actually be physically carrying on site. And make sure those are going to be in line with your scope and service. We will recommend medications based on efficacy and economics, so low cost, high outcome medications. But of course, we carry over 3,000 different medications, so if it's in your PDR, we can likely provide it to you. We also want to make sure that the process is going to be convenient both for your staff and your patients. We understand if it takes up provider time, it's not worth it. And so we've done everything that we can do to decrease the touch on the provider side and even the touch on the MA side to make it a seamless operation for both your staff and your patients. Know about the results that you want. So if you really want to make this a PACE-centric program, talk to us about it. We will give you some ideas on how to best do that. And then, of course, make sure it's profitable to operate. That may not be everyone's number one goal with this program, but you at least want the program to pay for itself, whether it be directly or indirectly through some benefit. I would tell you, after working with some of the most successful dispensing programs out there in the marketplace, the service identity was huge. So for the urgent cares, I went to XYZ clinic last night. I was seen in 30 minutes and left and was able to leave with my meds. That's a competitive advantage. We've actually seen our urgent care centers grow at a much faster rate than the average urgent care centers. And we think hopefully at least some degree of that is due to us. Make sure that the staff is educated about the program. We have people that their entire job, and they've come from the clinical ops world, is to talk to you about workflow and come up with operational plans and not just give you a box of meds, but help operationalize this for you. We also will supply you with marketing collateral, which is a passive marketing program to help inform your patients about the program, have access, instead of having them come up to the system. For those people that are interested in commercial adjudication, what I've seen work very, very well is an adopted check-in process. So when you check the patient in, and you're getting their information, we also capture their pharmacy benefit information and plug that in before they're actually seen by the provider. So we go to adjudicate the claim on the back end. We do not have to require and ask for that information. So as I said, formulary is going to be a key component to this. So a couple just parameters that you want to keep in mind is who's going to control it. Is it going to be at a medical director or clinic owner level, or are you going to allow the individual practitioners to carry what you'd like? My normal suggestion in a large environment, you probably want to have the medical director or owner take care of that. In the smaller practices, the individual practitioners usually do a pretty good job of keeping their formulary tight because they know what they prescribe. Make sure that you take in scope of practice. If you're next to a large university or something, you can use this program to really help market through that, because many student health plans do not cover insurance. If you have pediatric medicine or do a lot of travel medicine or have certain geographic things, keep those in mind as part of your scope of practice, because we want to be able to support you on the pharmacy side for what you do on the medical side. And then, of course, do you want to carry controlled drugs? Do you not want to carry controlled drugs? And, of course, the patient levels that you see will determine how broad of a formulary that you can offer. A lot of people ask, so for how many drugs should we have on our formulary? That's going to depend. Urgent care is going to have about 25 to 30. Family practice is probably going to have closer to 80 to 100, just because their scope of practice is much larger. What to charge for the medications? So in a patient pay, your target range is going to be about $5 to $15. That's about what the market will bear per medication. Many people go in at a lower charge level to create a marketing advantage. A higher level for things like that aren't normal, if it is like Malrone or Tamiflu or something like that the patient has that costs more, there would be a higher rate that would be charged for that medication. Workers' compensation, I'm assuming most people on the phone are from California. In California, that's on Medi-Cal fee schedule. It's typically just billed out with the workers' comp claims. Not every medication will be paid. California pays pretty well. It pays slow. But there is very good reimbursement on the workers' compensation still here in California. And then a commercial adjudication. And that's where we get you in line with our network. We're considered a chain pharmacy by NCPDP. So we enroll you into our network, and you have access to bill virtually every plan that a local pharmacy would have. When you look from an economic standpoint, we look at annualized visits of an average practice. This just happens to be an urgent care. I wasn't sure who's going to be on the call, but on average, they're going to see about 13% work comp, 12% self-pay, and 75% commercial insurance. So we look at different capture rates, different RXs. But in this example, net profit of about $200,000 for an urgent care is pretty much right on the money of what you can expect. For family practice, it could be much larger, it could be much less. It really just depends on what your patient population is and what medications that you guys are dispensing. Because everyone on this call is a member, we have a number of items at no cost. So our average initial order is about $3,500. That comes on net 30-day terms. So in many cases, you're able to pay for the system before your first payment's due. There is no software access cost. So we do not charge you to use the software because of your membership. We do provide you with a barcode scanner when you're starting up, and we also will provide you with pharmacy paper, bags, leaflets, etc., and as well as the installation, training, and support. All is of no cost in this, through the program, through your partnership. Dispensing licenses is not an issue in the state of California. NCPDP does cost $200. It will cost up to $425 in total to get you all your insurance contracting. So those other fees come from various different PBMs which charge a network access to their system. Then, of course, you just need some place to store the medications and then source a laser printer. But in most cases, our average customer is able to start up their program for under $5,000. So as I said, very low entry, very low hurdle to clear from a affordability side, but it really addresses your number one ancillary. It is patient preferred, and is obviously a way that you can look at to increase additional revenue at your clinic. So hopefully I'm about on time, Veronica and Dustin. But if it's okay to you guys, I'd like to open up for questions.
Yes, thank you very much, Dan. I'd like to let everyone know, if you have any questions, to please type them in the window there under questions. I'd like to start off with one question to you, Dan. You mentioned that the physician or administrator can be in charge of the office dispensing. Is there any additional certifications that a non-MD will need to acquire to dispense out of the office?
That is going to be dependent on what type of clinic it is. So there are certain licenses for certain types of clinics. So from a very low level, there shouldn't be anything that would come up, but there are certain circumstances. But of course, we will let the members know that on a case-by-case basis.
Okay, sounds great. It looks like a question came in, and it is: do you carry gluten-free medications?
We do carry some. Now, it is not possible to get every medication in gluten-free, but we do. We have carried that for clients, and we could certainly do that.
Okay, here's another question. What is your experience with handling pediatric liquid medications? Specifically, do most of your pediatric offices or urgent cares add the water to the bottles?
Sure. So a lot of the pediatric clinics that we work with, a lot of them like the fact that they can do the constitution, or at least walk the parent through the constitution of it, because it is often incorrectly done. So we offer a number of products in 4-ounce bottles that it already comes constituted, and other products that come in powder form, which you have to constitute yourself. So some clinics will do it for the patient at the time of dispense. Some will instruct the patient or the patient's parents on how to reconstitute that liquid.
Okay. Here's another question. Does your system allow for dispensing of casts, crutches, splints, earwicks, etc.?
Absolutely. So we have an entire barcode database. So if it has a barcode, our system will recognize what that product is, as long as that barcode is registered. And if it does not, you can scan the barcode and you can tell the system what it is. So you can do you can dispense vaccines, you can dispense virtually any product. We even have people that have done Diet Cokes and calendars. It really is a true point-of-sale system.
Okay, another question. Is there additional liability to in-office prescribing?
There is no additional prescribing liability. So you have the same liability as if you were to prescribe the script. The only thing that you have to that you're taking on additional responsibility for is to making sure that you basically hand the patient the right script, which we have a number of different checks. So when you go to select a medication in the system, our system knows what the barcode is supposed to expect back. So if the two don't match, it won't allow you to continue the system. So we do have that extra stopgap in the system.
Okay, where do most offices store the medications?
Sure. So a lot of people have converted their old sample room into a dispensary. A lot of people have their dispensary at one of their nurses' stations. Some even have it in the front area where the checkout is. The best practice is to keep it somewhere within the flow of the actual group. So we really want to make it work with the groups. We have pod dispensing. So say if you have a larger clinic which has 3 or 4 different pods within it, they can actually share inventory but dispense from different pods. and it allows you to transition inventory from one pod to the other. So it allows you to have kind of constituted data if that's something you're looking for.
Okay, we have a couple more questions here. How quick is the turnaround time from ordering to receiving the products?
It's going to be maximum 3 days, unless there's a manufacturer back order. If it is a manufacturer back order, then we'll give you an ETA on the time. If it's a refrigerated item, we only ship refrigerated items Monday through Wednesday. So refrigerated items may take a few extra days.
Okay. Can you dispense CPAP equipment?
That I do not know about. So we do not sell CPAP equipment. The system can track virtually anything. So although I can't definitely say yes, I have never done it in the past, so I can't confidently answer that.
For a family practice, internal medicine, or pediatric office, what is the typical additional profit for those offices on an annual basis?
So with the internal medicine and family practice, assuming that you're like most, which is going to be probably 80% of your patient base is going to be commercial and Medicare, you're probably looking at an additional profit of probably anywhere between 50 to 200,000 per provider.
Okay, we have another question here. How does your company make its money?
Sure. So very, very simple. We mark up the medications. So we charge a packaging fee for those medications. So we buy thousands to millions of pills, and we run them in large batches. And we charge a fee for the packaging, and then a distribution fee for those meds. So there is a markup, but fortunately there's plenty of room for markup for us to make a profit as well as you guys as a customer to make a profit.
Okay, at the beginning we asked a few poll questions, and one of the questions were, do we have anyone that's currently office dispensing? The answer was no. Just wanted to share that. And then how do you feel your center could benefit from office dispensing? And 100% answered increased profitability.
Excellent.
Do we have any other questions before we close the webinar? I'd like to throw in another question, Dan. Is there an electronic audit trail of the medication dispensed? What kind of audit trail can the office depend on for the medication prescribed to their patients?
Sure. So we do serialization as a company. So serialization means that every single bottle that comes out of our facility has a unique identifier. That unique identifier travels with that medication throughout the dispensing process. And then once that medication is dispensed, then it is then given a RX number. So you're going to have both a unique serialized number, which is going to follow it from the moment it's manufactured to the moment it leaves your door, as well as an RX number from the moment it leaves your door to where it goes beyond that. So we're going to keep full record keeping. It's going to tell you who dispensed it, who was logged in under it, who it went to, what their name and information is. It's going to keep all the systems that any pharmacy system in the nation would keep.
Okay, great. We did have another question come in. And could you repeat what the annual additional profit is per physician in a typical family practice?
Sure. In a typical family practice, you're looking at $50,000 to $200,000 a year. The reason why the large range is just frankly utilization. If a provider's using the program often, then it'll be much more towards the $200,000. If they use it infrequently, then obviously it's not going to be as much. You can pretty much count on about $7 or $8 profit per script.
Okay. Here's another question. $50,000 sounds incredibly high. Are you sure about that return on investment?
Oh yes, we have clinics doing much more. So if you look at the number of scripts that your center actually writes, the average is going to be a little over 2 per actual patient interaction. So if you look at the patient load that you're looking at times by about 2, look at a capture rate of about 35%. 50,000 is very realistic, if not conservative, at a profit of about $7 per script.
Okay, well, with those questions, I'd like to see, Dan, do you have any white papers that you could send us here at Physician Partners, and then we can share those with our attendees today and or any other offices that would like more information on the return on investment or profits that their specialty can, achieve with office dispensing.
Sure, absolutely. I will get a kit together for further distribution, and then of course, if you could provide me with a list of specialty types on the phone, I may have some more personalized information for them.
Absolutely. Okay, sounds good. Well, it looks like no more questions have come in. This presentation has been recorded. We will have it available in the next couple weeks on our website. We will have the slides in a PDF that we can email out to all of our attendees. So at this time, I'd like to thank you, Dan, for hosting this webinar. Physician Partners is hosting a meeting in Chula Vista tomorrow on proven ways to improve your practice. And we will have a representative from AS Medication Solutions available at this meeting tomorrow. If anyone that is on the phone is able to participate, please attend tomorrow's meeting around lunchtime from 12 to 2. Give us a call here at the office if you'd like us to send you another invitation. And Dan's contact information has been displayed on the screen. If you haven't had a chance to get that information, please do so now. Otherwise, I'd be happy to email it to you. Again, thanks, Dan, and thank you to our attendees. Have a great day.
Thank you.